Hi, my name's Anne. Welcome to the Spinal Unit, Royal Perth Hospital, Shenton Park campus.
Hi.
The spinal unit here at Shenton Park campus is a 35-bed unit, and we take all the spinal cord injured people of Western Australia, so from the far north and the south and the metropolitan area. Once people are stabilised in the emergency department or ICU, they come down to the spinal unit, and we manage the acute care of the spinal cord injured patient and the rehabilitation of those people. And also we do readmissions of spinal cord injured people from the community for things like pressure areas or fractures or follow-ups. Once they get through the acute phase, it's all about rehabilitating them, teaching them how to dress themselves, feed themselves, look after their bladder and bowel, going to physiotherapy and occupational therapy, and going through a structured program teaching them how the spinal cord injury has affected their bodies and how to manage with that in the community. Morning, Shane. How are you? Sounds like you need a suction. You do? Okay, I'll sort that out for you. This is Shane Agnew. He's going to be 21 on the 20th of February. Is that right? Shane had a trail bike accident on the 27th of February last year. He was unfortunate enough to sustain injury. He dislocated his neck from his occiput, which is actually the highest cervical injury that I've ever come across. Anyway, so what's happened to Shane is that he's unable to breathe for himself. He was actually lucky enough to have someone at the scene of the accident that was able to resuscitate him. He's unable to swallow food, so he's fed by a peg. He has a ventilator to help him breathe. He requires suctioning to get rid of his secretions. We're trialling a cough machine at the moment, which is doing really good for Shane's chest because he's been having a lot of chest infections since his injury, spent a lot of time in ICU. Shane requires all the usual things that spinal patients require: frequent turning, assistance with showers and dressing, hoisting in out of bed, all that, cleaning teeth and all that stuff because he can't use his hands at all. So that's about it, Shane, isn't it, really? It doesn't, like, having a new patient come in isn't any easier. I've been here for over 20 years and it doesn't get any easier because it's a life tragedy. It's not only the patient that goes through this life-changing, terrible thing, it's the whole family that you have to deal with. And I think the psychological issues with managing somebody who's had a serious life-changing event is probably the hardest thing to deal with here. There's
We were asleep and the phone rang, realising, it was far too early in the morning to have a phone ring, the terror that strikes at your heart. My husband answered the phone and he just said, yes, is it really bad? I remember him saying that. He said, we'll be there as soon as we can. And I remember, your heart just sinks to the floor. So, I just said, what's wrong? It's Tanith, isn't it? And he said, yes. He said, hold yourself together. She's been in a very bad car accident. Things are very bad. She's at the trauma unit at the Alfred and we've got to get there straight away. He had to wait a long time, almost an hour to see her, and in the end I just lost it and demanded to see her. Because they kept saying, we've just got to clean her up, we've just got to do this. And in the end I thought, no, that's my baby. I want to see her now.
I sat down with the doctors and the doctors actually said to me, there is a chance that she's not going to come out of coma. And they actually did give me an option to start thinking about the option of turning off the machines on the Wednesday, which was 2 days later, and just to start thinking about that on the Monday morning. Like, once she woke up, because she opened her eyes for the first time that Monday night, it was just the happiest time of my life when I saw her open her eyes. The nurses were just, they were unbelievable. I don't know how they do it in ICU. I wouldn't be able to do something like that because they were just they were so strong for you, and just they were explaining everything that the doctors didn't explain. They explained.
When I was on the ward, I was just really desperate to get here, knowing it was the last step before I was able to go home. But when it came time to leave the Austin, because I'd, formed quite strong attachments with the nursing staff and trusted their ability and trusted the way they knew how to deal with me, it was quite frightening to come over to rehab and start it all again. Like, in that way, it was really frightening, and I was a bit teary, but it didn't take long to fit in. The staff, from the very beginning, the staff were fabulous here.
Her primary nurse is Helen, and she's just been terrific the whole way through. Any problems you have, you just go to her, we have a chat, and she can help us straight away, or she goes away and finds out something for us and then gets back to us straight away.
I'd say there are three components to our role, really. One is the day-to-day care. Another component is that we do what we call educate our patients, and we teach them what it means to have a spinal cord injury, what are the implications and complications, how it might affect their lives, and how to overcome obstacles or learn to live with them if they can't be overcome. And the third component is that we help plan their discharge.
I'm completely dependent upon my carers. So getting dressed, getting undressed, being moved from the bed to the wheelchair to the shower commode, I'm dependent completely upon other people. So the showering process has to be done by the staff, toileting process by the staff. I mean the bowels, I don't mean urine, because I've got a catheter for that, but they have to do all of that. And if you don't have a trust or some sort of connection with your carer, it's very embarrassing, because they're quite personal things they're dealing with. And from the very beginning, Helen is so soft and gentle, and her nature is so caring that she makes those procedures not embarrassing at all.
But given the effort that you see them making to face the challenges and overcome or live with the obstacles, to me it's almost self-indulgent to allow it to depress you. We come here as nurses if we choose to stay. We're here to nurse, and it's more inspiring than depressing. Clearly it's a negative experience that people are going through, but I myself focus on what's needed for each day to help that day, to help the person get through, our patients get through that day successfully, and that's the focus. And then, without realising it, or time passes and you see what huge gains they've made, and well, it is inspiring.
When you sort of sit at home, and even though you get home late and you more or less, I just go straight to bed, but you sort of sit there and go, well, I want my wife to lie next to me.
That shouldn't have happened. That's the ridiculous part of it. It should never have happened. And I have been angry here at the Austin, and certainly I've had my low periods where I've been very tearful and had really struggled with the injuries. But it was recently our second anniversary, and I got really sad when my husband left, because I thought I shouldn't be here in rehab. I should be with him, celebrating our anniversary. But I shouldn't have been ripped from my family. I should be with my husband, building our house, doing all the things that we'd planned to do.
I'm trying very, very hard not to be angry with him. I study philosophy, so we're very spiritual people, so we don't want to be angry with this lad. He certainly made a cross to bear for the rest of his life, and he'll be punished in that way. We don't feel that going to jail will help, which we've been told is a possibility. But sometimes I feel such despair that I want to kill him for what he's done to my child. For being so stupid.
That's so sorely.
She is so positive. She is so determined. And I guess one of the things I say to people, as a parent, you think you know your child, but you don't. I had no idea she was ever this strong. I know I couldn't be.
She's the biggest inspiration of my life before the accident, but now you come in here and I just can't stop smiling, because you just see her and how far she's come and what she can do compared to a month ago is the greatest buzz of all time.